Our practice name is Nyctal Family Chiropractic and Physical Therapy. We're located in Queens, New York. When I first started, it was just chiropractic, but I found that we mix it together with physical therapy, patients respond much faster. To realign the spine is one thing, and then putting the physical therapy rehab into the spine to making sure that alignment stays in place is very important for long-term relief.
Customers come back because usually they're wowed by the 5-star chiropractic services and they love Raquel.
Usually I work with them to get the muscles prepared for any adjustments with chiropractic. After adjustments, I also work with them to strengthen and stabilize the area of the spine.
We travel all over the country to obtain the most recent and advanced information on the healthcare and equipment that we use here. One of the major things that we use that utilize during the spinal rehabilitation is spinal decompression. Spinal decompression, anytime patient gets into some type of accident or injury, they herniate a disc. So from a medical perspective, what they do is they do an injection or they decompress the spine by taking the disc out. So what we're trying to do is to avoid surgery. It's a lot more safer and a lot less risk with the spine is to decompress the spine by pulling the spine away so the herniation can go back inside. Okay, so this is a normal disc. This is the vertebra, lower disc, and the vertebra. This is where the spinal cord goes, and then we have nerves that come out from both sides. When there's a compression of the spine, right, so what it causes is this disc starts to go back. And when it goes back, this is called bulging disc. And if it goes too much, it comes out and it pushes on the nerve. If you can see, this nerve is a lot thinner compared to this one. This is inflamed nerve. This can cause lots of pain, sciatica, or going down the arm or into the leg. This is called herniation, and this is called bulging disc. From a medical perspective, they would come in here and they would cut this off. Our objective is to avoid surgery, and risk of surgery is to decompress the spine by allowing this disc to go back into the spine. We also use what's called active therapeutic movement, and we use laser therapy. So what keeps us apart is that we address 3 puzzles of health. One of them, structure, which we talked about, the spinal decompression and the spine in general, and rehab of the spine. Okay, second is the nutrition. You know, a lot of people come in with back problems, and what causes it is too much pressure on it, and what is it is too much weight. So we address nutrition. We help patients to lose weight. And puzzle number 3 is stress, reduction of stress. You cannot do one or the other. We have to address the 3 puzzles of health. By giving our patients their health back, their functionality of their spine, it just changes their whole life. That's what drives me to come here to work.